There's concern tonight over the availability of ventilators, and a local doctor says he may have a way to double the supplies in some places. Tonight, News 4's Ashley Lincoln joins us live from SSM Health on South Grand. Ashley, he says he knows of a way to turn one ventilator into two.
That's right, Samantha. He tells me that this method could actually double the amount of patients that would have access to these machines. Now, one concern that a lot of doctors are having is that if these positive cases continue to increase and they don't receive any new ventilators, then they might have to use this method.
We hope for the best and plan for the worst.
It's a technique medical experts tell News 4 they'll have to lean on if ventilator supplies don't increase.
There is a desperate need for increasing the numbers of ventilators.
Dr. John Fontana with St. Joseph Hospital in St. Charles says he's looking to educate more medical professionals on capabilities to expanding the use of a single ventilator to benefit two patients.
You take the end of the ventilator circuit that would normally go to one patient, and you're splitting it for two patients. It's not difficult, but it's very crude, analog, old school materials.
Here is video of what this will look like. Fontana says he learned this method while serving in the military over in Iraq.
This was a method that we used occasionally when I was in the military in Iraq, when we ran out of ventilators.
If used to help treat COVID-19 patients, Fontana says they would place patients with similar symptoms on the same ventilator, using a Y-shaped tubing so each individual could get air to their lungs. He says the pressure this virus is placing on both New York and Seattle's healthcare system gives Missouri's medical professionals a leg up on ways to work around the ventilator shortage.
You see what's happening there. They're being overwhelmed by the needs and the lack of resource. We are fortunate that we are only beginning where they were 2 or 3 or 4 weeks ago. And so we've had some time to try to observe and learn some lessons and try to get better prepared.
He says with increasing coronavirus numbers, medical professionals are trying to stay ahead of the threat as much as they can.
We're really fairly early in this process. It could get much, much worse.
And he also tells me of the SSM hospitals, DePaul Hospital actually has the highest number of COVID patients, along with the highest number of patients needing these ventilators. Reporting live in Midtown, Ashley Lincoln, News 4.